So today we're going to learn about the remedy Kali Carbonicum from Dr. Nash's Materia Medica. Leading symptom of this remedy, that is the stitching pains. The favorite locality of Kali Carb is actually the lower right chest. It helps us understand a little bit about how to think when you're studying Materia Medica. This is actually an important map of Kali Carb which we need to remember. Hello and Namaste. So today we're going to learn about the remedy Kali Carbonicum from Dr. Nash's Materia Medica. And as you know, Dr. E.B. Nash groups remedies together for easy understanding. Like digestion remedies are all grouped together, mouth remedies are all grouped together. In the same way, he also groups together all the Kali remedies, Kalis, and the remedies are Kali Carb, Kali Bi, Kali Iode, Kali Mur, and all these are what we're going to study now, one by one in this series of lectures, starting first with Kali Carbonicum. Okay, so Kali Carbonicum has a very, very important symptom in it, which also Dr. Nash mentions mentions to be the leading symptom of this remedy, that is the stitching pains. Okay, Kali Carb leads all remedies in this particular symptom. Although we also know that Bryonia is a remedy which has the symptom, but the leading remedy is Kali Carb. Now, how do we differentiate Kali Carb from Bryonia if both of them have this symptom? So in bryonia, we mostly see that this symptom is present in the serous membranes or in the lungs, in the pleura, right? In the serous membranes, okay? Whereas in Kali Carb, we see that this kind of pain is located anywhere, everywhere, in almost every tissue, even in the teeth of Kali Carb. Okay, so that is how characteristic it is, and that is why it is the leading symptom of Kali Carb. Okay, now we also see that bryonia has this characteristic aggravation from movement, while there is amelioration from quiet when they are not moving, when they're resting, when they're quiet. But this is not what we see in Kali Carb at all. So the pain is completely independent of movement in Kali Carb. These two are the main important differentiating symptoms when it comes to stitching pains. But see, in Kali Carb, since the pain is located everywhere, this remedy becomes the leading remedy for this symptom. Going ahead, we see that if at all Kali Carb also has this symptom or this kind of pain in their lungs, in their chest, then where does it act? So the favorite locality of Kali Carb is actually the lower right chest. Okay, so in the lower right chest, this pain, so over here, okay, in the lower lobe or in the middle lobe, lower lobe of the right-sided lungs is where this remedy specially acts. Okay, although we should also remember that if the symptoms of Kali Carb are there, like there is this stitching kind of pain and the many characteristic symptoms that we are going to talk about in this whole video, if they are there and the location of the lesion or the pneumonia patch or whatever the pathology in the lung is on the right lung, then also Kali Carb will be indicated. But its favorite locality, if you ask Dr. Nash, it is lower right chest. Okay, so the pain is very characteristic in a way that the pain will run from the lower right chest, okay, from the lower right chest through to the back. So this is the kind of pain that you see in this remedy, okay. The pain runs from the lower right chest through to the back. Fine, these are the two important things that you have to remember. Now, if you see what is the situation in pneumonia or pleuropneumonia, if sometimes, we take the totality of pneumonia and we find that the remedy indicated is bryonia. Fine, you give the patient bryonia and still the patient does not, get better. Then what will be the next question that you ask him? It will again be dependent on the differentiation that we did just now. So you will ask him if there is any aggravation from movement. And if the patient says yes, whenever the patient moves, whenever the patient coughs, there is pain in the chest, then you will not continue bryonia and you will give them Kali Carb. And many times in such cases, when you give Kali Carb, the patient gets very, very better. So you see, Kali Carb also follows bryonia, but Dr. Nash also mentions that maybe Kali Carb was the remedy which was always indicated even from the start. But you gave bryonia because of your failure of understanding the totality, and it did not act because it was not the similimum, and then Kali Carb did its work. Okay, and also while doing this, you also have to remember the other remedies for pneumonia. For example, if you have this patient who comes to you for pneumonia and who has this sweat okay, which is coming, the patient has sweat, but it does not relieve the patient, okay, no relief even after sweat. And like we saw in Kalikab, the affected locality is the right lower lung, okay. Then what remedy you have to think of? Yeah, it's Mercsol. Okay, it's Merc virus or Mercsol, right? So this is quite a little bit of the remedy relationships or differentiation of remedies that Dr. Nash does for us, which helps us understand a little bit about how to think when you're studying Materia Medica, how to understand Materia Medica, right? Moving on, we now see that Dr. Nash also talks about how profound an influence this remedy, Kali Carb, has on the blood making process. Okay, so we see that this remedy, has this lack of RBCs. Fine, there's lack of RBCs. There is anemia. That is very very important. You have to remember anemia when it comes to Kali. When you think of Kali Carb, and due to anemia, you see that the skin is very pale, very milky white in color. So all the symptoms of anemia will be there, and most of the times, when do you see anemia in a patient? When they are in their puberty ages, and you also find that they do not menstruate well because of the poor quality of blood and the profound weakness that they have. There is very scanty menses. You also find that this kind of situation exists when the women are in their menopausal age or when people are old. So in all those conditions you find this anemic state. And what do you first think of when there is anemia, especially in puberty? You think of remedies like Ferromed, you think of remedies like Pulsatilla, but many times these don't act. Then what do you do? We can also think of Kalika, but for you to prescribe Kalika, there have to be some other symptoms also that accompany it, right? You cannot just prescribe any remedy actually on the basis of just one symptom or on the basis of diagnosis, like a diagnosis of anemia. So let's understand what are the other symptoms that accompany Kali Carb with anemia. Okay, so we see Dr. Nash mentions that dropsy or baggy swelling, especially baggy swelling of the eyes, is a very important symptom. Again, another of leading symptom of this remedy that you can find in this remedy with anemia. Okay, so whenever there is anemia, you most of the times also find the baggy swelling of eyes, and then you have to think of Kalika. Fine. Along with this, there is another symptom very very important for Kalika, which is the backache of Kalika. There is lameness, there is backache, in this remedy Kalika. Along with it, you also find a lot of weakness, profound weakness, and this weakness can be of two types, muscular as well as nervous weakness. Okay, and with this generalized weakness that this patient has, also their heart is very weak because the muscles all over their body are weak, and also the heart muscles have become weak. So the heart's action is very irregular, intermittent, and you see all of these heart symptoms also because of the generalized muscular weakness. We'll also talk about the nervous weakness a little later. Okay, but one thing that is very leading in this remedy but is missing over here is what Dr. Farrington mentions. He mentions that along with this weakness and this backache, there is one more symptom that accompanies, which is sweat. Okay, so along with this weakness and backache, there is sweat. So here we see these symptoms in this remedy Kalika. There is anemia, there is all the symptoms of anemia with the bagging swelling of eyes, with the backache, there is also sweat that Farrington mentions, there is weakness, generalized muscular weakness, which you can also see in the heart muscles. And this is actually an important map of Kalika, which we need to remember. And do not forget the stitching pains that we discussed earlier. Okay. Moving on ahead, we see another very, very important modality of this remedy, which is especially in cases of pneumonia or asthma or hydrothorax, they want to sit in this position in which they are sitting up and they're leaning forward. Okay. Another modality is the 3 a.m. aggravation that you see in this remedy. It's very, very characteristic. And Dr. Nash actually mentions one case related to this, which we will discuss in a short span of time. Before that, let's also discuss the bloating that this patient has. Okay, Dr. Nash compares this bloating that this patient has with remedies like lycopodium, like carboveg, like China, which do form a group of remedies that Dr. Nash actually has mentioned in his book. Please do comment what that group of remedies is called. For example, like we have all the Merck remedies as mouth remedies. So what is this group of remedies called? Which is Carbovich, Lycopodium, and China. And it's very easy to guess because the topic is already there. But still, would you guess it and let me know in the comments? Okay. Now we see this weakness in these patients that we have already talked about, and in this weakness he does also mention that this patient has become so weak that he just that this patient just drops into the chair and or throws herself into the bed, right? What we also see is that another modality in these patients is that they have this aggravation when they lie on the affected side. So if the right side is affected and they lie on their right side, then the pain will get aggravated. In the same way, if they have left-sided pains and they lie on the left side, then the pain will get aggravated. So we also see this. Now let's discuss about the two cases that Dr. Nash mentions. So here this patient who comes to Dr. Nash has these symptoms that he has tuberculosis of the lung, which is low, and the lower right lung that is mainly affected, with profuse expectoration, which is pus-like, emaciation, and no appetite. And the main thing that Dr. Nash actually wants to highlight here is that this patient has been to most experienced, most elder, senior doctors of his times, and still he has been pronounced incurable. It has been said that he is going to die now. But he comes to Dr. Nash, and on the totality of symptoms, Dr. Nash gives him Kali Carb, and just within 8 days of giving Kali Carb, okay, one dose once in 8 days of Kali Carb, this patient gets completely well, and even 25 years later, when Dr. Nash is writing about Kali Carb, still the patient is alive, hale, and hearty. And this is what Dr. Nash mentions. I'll just show you what he writes himself, is that such service from any remedy makes a man fall in love with it. So I hope you also are falling in love with Kali Carb because of its miraculous results that Dr. Nash is showing us. Okay. Another case is of a very renowned doctor of his times, Dr. T.L. Brown. His father-in-law was ill, okay? His father-in-law was an old man who had hydrothorax, dropsy, but all his symptoms would get aggravated at 3 a.m. So this is a very, very characteristic modality of Kali Carb. Okay, all of his, especially chest symptoms, get aggravated at 3 a.m. And this is something that guided Dr. Nash to give him Kali Carb, and Dr. Nash gave him Kali Carb, and this old man, I'll again show it to you. Dr. Nash writes about it. Okay, so he says that after giving Kali Carb 200, such miraculous results were found in an incredibly short time that the old man was well and never had a return of that trouble. He lived for several years after and finally did not die of dropsy at all. The day of miracles is not past yet. Hahnemannian homeopathy performs them still. So this is how homeopathy is very beautiful, and Dr. Nash is somebody who is like making us fall in love with it. Before signing off, there's one thing that we have to still understand, that is the weakness of Kali Carb, the nervous side of it. Okay, so we talked about the weakness of Kali Carb, but the nervous weakness of Kali, we talked about the general muscular weakness, right? So in the nervous weakness of Kali Carb, we see that these patients are very, very sensitive. Their nerves are very, very sensitive. We see that they cannot bear to be touched. The nerves are so sensitive that even if you touch them, they'll not like it. And when they are touched, especially on their feet or on their soles, they cannot bear it at all. Okay, and they're easily frightened. They shriek about imaginary things because they're so sensitive. So this is just one point that we did not mention while talking about it. And another one is that there was sticking pain in the throat. Okay, in Kali Carb we see that there's this pain like something is sticking or something is pricking in the throat, like we see in Heparsulf, Dolichos, nitric acid, and argentum nitricum as well. So I hope you will like it. This is all about Kali Carb, and do remember to comment about the group of remedies that Carboveg, China, and Lycopodium are grouped into by Dr. Nash. What is it called? Thank you and have a nice day.